So
very
now
necessary
coming
for
to
me.
C-section, like what are the most common reasons, though you have touched them, but in case there are more, and when the doctor turns to this. So what is basically, I think let's elaborate a little more so that they have a better understanding of it.
Right.
In terms of why I'm saying this, there are two things. Number one, जब आप सी सेक्शन सजेस्ट करते हैं तो हर जना डॉक्टर की उसको डाउट करता है
हाँ हाँ
राइट कि ये डॉक्टर तो सी सेक्शन करा देता है और अगर आप नहीं करते कुछ गलत हो जाए
So
this is I'm talking from a doctor's point of
Yeah.
view also, and from the patient's point of view, it's very important to understand because आप अगर आपको अगर इस चीज की समझ है कि
Correct.
डॉक्टर आपके लिए सही डिसीजन ले रहा है, there's respect for the decision,
Correct.
you will also help in taking that decision.
Right.
एंड अगर आप नॉलेजेबल हैं इस चीज को लेके तो आपको पता कोई आपकी एडवांटेज में नहीं ले सकता है,
Correct.
राइट
Right. So why and when is a C-section important, right?
राइट
Basically, there are multiple reasons coming to the maternal reasons for that, or there are fetal reasons for that.
Right.
For the maternal reasons, one is increased age. Okay. So increased age itself is not a criteria, but we call it in our textbooks. It's written as elderly primary.
Okay.
So anybody above the age of 35,
okay,
they're considered to be precious pregnancies. And there are generally medical complications with that. So that mother can be having diabetes during pregnancy or can be having hypertension during pregnancy. Such females are, in other maternal complications is if they are high risk candidates with cardiac issues or patients on certain drugs of epilepsy who can't bear the strain of a normal vaginal delivery are asked for a cesarean section. Moving on to fetal causes. So fetal causes include a breech presentation. For example, the baby is in the opposite directions, the leg first and then the head. In that case, the body will deliver and the head will get stuck. And that's when the actual problem arises. So breech presentations and transverse lies and all of that are a textbook indication for elective cesarean section.
Right.
Also, like a non-progress of labor. So the doctor will keep waiting till you are 39 weeks, say 40 weeks. And 40 weeks and we see no signs of you ending up with a normal labor or not.
Right.
It's your vagina or your cervix is not primed for a normal vaginal delivery. Then you have to weigh the risks of waiting and the advantages of not waiting, right? So you have to balance that out, and that is when if we don't see a progress, we do counsel them for a cesarean section. So non-progress of labor is what we call it, right? So these are a few indications when you don't, and obviously you're giving a trial to a patient, and if things like fetal distress happen or the baby passes stool or the labor is not progressing, the mother gets exhausted, there are multiple causes. In all these reasons, once you're giving a trial, you do have to shift the mode of delivery to a cesarean section for a better outcome for both the mother and the baby.
Absolutely.
Yeah.
I mean, it's to avoid the risk and the complications both for mother and child.
Yes. So would you go through 9 months of pregnancy, and would you even take that chance because nothing is 100%.
Absolutely.
Right? So would you want to take that 1% chance as well that it's okay that you still go for a normal delivery? No, nobody, no parent or no couple or nobody, no patient is ready to even take that 1% chance.
Absolutely.
So when you feel like it's swaying more towards or it's risking the mother or the child in any way, that's when you take a call to go end up with a cesarean section, because that's going to be safer for both of them.